My teeth were a mess. I was always very self-conscious about it, and so I covered a lot. I would talk with my hand over my mouth. And I finally reached out to Dr. Beck. I was just so amazed at the work that they do here. I was thrilled to have the bottom teeth were rotting out. I was afraid to brush them too much because some of them were loose. Dr. Beck came up with a plan. Okay, we're gonna do this, and we're gonna do this, and we're gonna do this, and my head was spinning with. I didn't understand it all, but it sounded good. They did the bottoms, and I went home, and my wife started crying. Started calling me Mr. Grin because I was going around with a big smile. My gratitude is, I can't even put it into words. Sorry, I'm just very grateful, and I can smile without doing this.
We are the region's largest safety net dental provider, meaning that we provide dental care services for everybody regardless of their ability to pay. Generally, we're in the neighborhood of 13,700 patient visits per year. We also serve as a CODA, Council on Dental Accreditation, dental GPR training program. We train 6 to 8 residents per year. We were recognized by the Anthem Foundation of Cincinnati as the safety net of the safety nets, a moniker which we take with great pride. We were recognized by DentaQuest as one of the top 3 safety net dental programs in the country. We have received Akron Children's Hospital Award for advocacy for children's and oral health. We received the Ohio Department of Health James Quilty Award for services to improve the oral health of the citizens of Ohio. We see patients on a number of different venues. We are presently sitting in our 8-operatory fixed ambulatory dental clinic. We provide some 8,000 to 10,000 patient visits annually here. We also serve patients in the operating room, special needs patients, patients that are medically compromised, patients, children that are very young. We also provide our mobile dental outreach services.
Special needs and pediatric patients may need more time. With our autistic patients, it really varies. In our office, we have extra hands, which is great. So someone is constantly talking to them, holding their hand. One of the things that we do have for this operatory where we do see special needs is a door. So we can block out some of the ambient sounds.
With his disability, autism, he really doesn't like the dentist. So we ended up finding a private dentist, and she was good, but it was out of her realm. She recommended us to Mercy Health, and it was great. It was a very hard road, but they were very patient with us, very happy with the care he had. 2 more visits, and then we will have our implant of our teeth. And he has done excellent. I couldn't thank you guys anymore because we got to get the kids smiling.
I really want a new teeth because I don't want to look like this.
We provide all preventive and restorative services, some simple extractions on the van. We serve rural populations with limited access to care. We serve the Hispanic populations where we bring a Spanish interpreter, and we also serve the inner city population. Those that are physically challenged, we have a handicap accessible entrance. The children that we see are normally from lower income. Going into the community and beginning early with those children, we make a lifelong difference because we know that without oral health, there is no health. It's the #1 unmet healthcare need in the nation.
When I came out of high school and I went into the United States Navy, I assumed, being a veteran, that I qualified for dental care through the VA, but I didn't. With the dental van, I had the x-rays. They did a general teeth check. I've actually had a tooth extracted. I had broke a tooth last year that was causing me some problems, so I had that taken care of. I'm not gonna just say how important it is to me. It's important to a lot of veterans. I know older veterans that I talk to, it becomes a debate of, do I pay for dental care or do I take care of my needs? Especially with COVID, some have lost their job and they lost their dental insurance with it. So this program is very important, not just to veterans like me, but to all veterans.
There's veterans in the community that haven't been to the dentist in over 20 years. Since February 6, 2020, we probably had probably close to 250 veterans that have already come through the Mercy Health Veterans Dental Program.
I would say to anybody who gives to this program, I'm very grateful, I'm humbled, I'm honored. I don't know where the state of my mouth or my teeth would have been. I wish that they keep doing what they're doing to help veterans like me.
You guys are going to give him his smile back. I'm grateful for that.
I'd like to thank all of our donors. I'd like to thank them for their trust, their confidence, and their continuing support in our program.
And I'm just incredibly grateful for the opportunity to be able to smile again.